So, somebody has asked, what are some of the red flags that one should look out for in a therapist? This one is an interesting question.
Yes. Pehla, I guess, is professionally, are they even eligible to do this therapy for you, to counsel you? वो हमेशा आप
Yeah.
देखें. Are they able to give you attention? You know, some people, when you, for abhi obviously COVID की वजह से, a lot of it is happening on phone and through video calls वगैरह, but in person also, how do you feel? Like, do you feel comfortable? It's very important to consider that as well. अगर आप अपनी कहानी बता रहे हो और therapist बैठकर सिर्फ घड़ी पे अपना time देख रहे, it means they're not interested, as simple as that. Or, you know, are they judging you? Because this whole thing is based on a non-judgmental space. It's supposed to be a safe space, and that is what that's the difference. You're trained to listen very non-judgmentally and in that present moment. So अगर therapy, जैसे अगर आप उनको कोई कहानी सुना रहे हो अपनी, आपके साथ क्या हुआ है, and हो सकता है वो उनके साथ भी हुआ हो, और अगर वो आपको जज करके बोलते हैं, see, this happened with me as well and I did this. If they're just giving you advices, that is not therapy. I think society में एक वो भी norm है कि a lot of people think that giving it's more about convincing somebody. Counseling is about convincing. I sometimes get people who tell me, my child is not doing this, can you convince him to do this, can you counsel him? That's not what counseling is. Counseling is more about, it's a facilitative approach where it's an empowering safe space where you help the other person understand their own issues better and find their own solutions. अब कई बार ऐसे urgently कुछ आप advice ज़रूरी हो जाती है, but otherwise it's through therapies and through the approach, the active listening वगैरह. And Carl Rogers बोलते थे, उनका एक approach था unconditional positive regard. You need to treat this person. हो सकता है कई बार, जैसे we were recently doing a training on psychological first aid and somebody asked that let's say a rapist comes to you as a आप therapist और आपके पास एक rapist आया and you, let's say, are against that. So how do you deal with that? So that happens, but at the same time आपको तब ये देखना है कि आप उस person की problem वो जो लेकर आ रहा है, आप उसको कैसे सुन रहे हैं. You don't need to use your judgment. Just understand, listen what they are saying in that moment. आपको अपने biases, it's very important to be aware of your own biases. And if you think you can't deal with those biases, you will become reactive, then it's important to let that person know that, I don't think I can do your therapy. I have my own personal reasons for it. So these are some of the red flags. इसके अलावा और भी कुछ हो सकते हैं, but it's very important that you feel safe, you feel comfortable, you know that this person is eligible, they're not judging you. And sometimes एक जो आप, how do you feel, मतलब जैसे how they should contact you. अगर आपको बार-बार personal messages आ रही हैं उनसे, when you have already told them you don't feel comfortable, या कुछ लोग आपको Facebook पे add कर लेते हैं फिर, all of this is very unprofessional, and it happens in this context a lot. I sometimes talk to people and they suddenly assume that I'm their friend. You have to be very aware of those things.